Okay, so here in women, we see that the spleen and stomach chi deficiency, and I think of spleen and stomach chi as a unit. You know, I think that oftentimes we talk about spleen chi deficiency, we also mean stomach chi deficiency. In women, it can cause anemia and irregularities in the menstrual cycle. So while certainly not all Shui deficiency is associated with anemia, oftentimes in this case there is anemia associated with Shui deficiency here in HIV. Many women with HIV have the problem with breakthrough bleeding that I mentioned before, and of course this is a symptom that responds incredibly well to acupuncture and moxibustion. And if there's hemorrhaging, of course we will recommend that a client see a gynecologist because it could be a sign of cancer or the tubal pregnancy that requires immediate medical attention. So one of the things is I want to also mention some of the red flags here that are important for us as practitioners in terms of recommendations to outside practitioners. You know, one thing is also, while I think that with all people, it's important that there be that recommendations, that there always be communication with the Western physician is especially important in HIV and in serious chronic conditions, and certainly with people who have cancer, people who have HIV. But the other side of it is that I also think it's important that we understand, you know, when somebody comes in with a particular problem, that not everything is related to HIV. So a lot of times people will come in and say, oh, I've got this really bad runny nose, and I've got a cough, and I've got a fever, and oh my God, do I have pneumonia, you know, that's HIV related? And so my question to them is, hey, who else around you? Has anybody had a cold or flu? Who's around you? Who you're working with? Oh yeah, everybody at the office was sick last week. I said, well, I think you have the common cold. You know, so it's not HIV related. But what's important is that you don't want it to get worse, and you don't want to get a bacterial infection by not taking care of it. You know, and so, you know, it's the old story of, you know, when you hear hooves in the you know, in the desert or in the forest, is, you know, is it always zebras? You know, no, it's not. It's often it can be horses. You know, so that is kind of what we always have to contend with this, because people with HIV always think that everything is related to HIV, and many times it's not. You know, there's something else going on that may be, you know, it's like the reflux may be associated with just having reflux because they have their whole family has reflux. You know, so it's not necessarily related to HIV or even to the meds that they're taking, although that might be worsened by that situation. So amenorrhea is also another common Shui deficiency problem, and deficiency can happen from AZT or chemotherapy. Remember that there are going to be more people who have HIV who may have cancers associated with HIV, so they may, there's a relatively higher rate of lymphoma, for example, among people with HIV, so they may be also going through chemotherapy treatment at some time as well. But when the spleen is too weak to transform food nutrients into Shui, resulting in amenorrhea, fatigue, paleness, and a weak pulse. So these are the signs, symptoms, and signs that you might see in a person with HIV with Shui deficiency. Another cause of amenorrhea can be Shui stagnation. So I think it's really important that the differential diagnosis is very important here. And so when somebody has amenorrhea, but then they also have a feeling that they have pain in the pelvic region. So somebody's pointing and say, oh, I have these sharp pains, or I have this stabbing pain, or they have the sensation of everything is just full. And we can go into the other causes of this, like Chong-Mai issues and all of that. But here, in terms of Shui stagnation, in terms of amenorrhea, there may also be breast distension, emotional stress, and that's associated with Shui stagnation and Qi stagnation. KS or Kaposi sarcoma, which still exists in the population. We still see people who are diagnosed with Kaposi sarcoma, can also be another sign of Shui stagnation. I know some of you who are at the seminar haven't ever seen any of these things, and so I'm going to suggest that if you're really interested, that you go to some of the HIV/AIDS websites and to there's also Wikipedia. There's also a number of different resources for being able to sort of look and visualize some of these issues, so that you can understand what I'm talking about more. I don't have slides of all of that. Often KS can be another sign of soy stagnation. KS is a disease that was normally found in older Mediterranean men and then started showing up in a young gay male population primarily. And we now know that KS is a co-infection. It's not necessarily a cancer, but it's a proliferative disease that's associated with a virus. And so there's often toxic heat and damp heat that's associated with KS as well. So not only are there lesions that are seen that are blood stagnation lesions, there can also be inflammation and redness around the area. And so, but it's got to be a differential diagnosis according to Chinese medicine. So here we are looking at one of the tongues of the catalog, the 5,000 tongue sides. Have a high percentage of people with HIV who have red spots or dots on the tongue. It's another indication of excess heat in the body. But of course, red dots don't mean somebody has HIV. It means they have toxic heat. So if we see somebody with Epstein-Barr virus, or we see people with various viral syndromes who have toxic heat, we actually see these red dots on the tongue. And this is kind of interesting. I use this slide because this really shows something that a lot of people, I think, have difficulty in understanding, is that you can have toxic heat and have these red spots on the tongue, no matter how pale the tongue might be. So you can have a swollen tongue that's pale, crack in the center, deficient spleen and stomach, and you have toxic heat. So this tongue could be a red tongue or a purple tongue or a tongue with yellow coating on the tongue, thin white coating on the tongue. It doesn't matter. There's still red spots on the tongue. And these are a little bit minor. These red spots on this particular tongue are not necessarily as strong as some other red spots or red dots that we might see on the tongue, but it's clear that there's toxic heat that this person is experiencing. And I think that it's really important to be looking for this when you're working with people with chronic viruses. One of the things that's interesting is when we did these 5,000 tongue slides, it was before people were on antiretroviral medications. There were only a few people at the time, and so everybody had red spots. Interestingly enough, many of the people who are on antiretrovirals, we lost something, huh? Should I keep going? Okay. All the people have red spots, and now what we see with people who are on antiretroviral medication who have completely suppressed virus, oftentimes actually don't have red spots on the tongue anymore. So I actually use that. I feel like we have to really pay attention. We have to pay attention. We can't just make an assumption about how much toxic heat there is based on just that somebody has HIV. We have to actually look at the tongue through the pulse diagnosis. Okay. So again, HPV warts, anal or cervical neoplasia are also signs of toxic heat. It can also be treated with high doses of clear heat clean toxin herbal formulas internally, which have antibacterial, antiviral properties, and topical herbal ointments is externally applied to the cervix or the anal canal.